Welcome all. Thanks for joining. This is Lindsay Mercer, Doctor of Physical Therapy and Foot and Ankle Specialist. And today we're going to be talking about what I would do differently if I sprained my ankle today. So I unfortunately have sustained a couple of ankle sprains in my lifetime. The first of which was when playing soccer, and the second was while playing basketball. Now, the way ankle sprains have been managed has changed significantly over the years. When I was playing sports, when I sustained my ankle sprains, R.I.C.E was the standard protocol. R.I.C.E may sound familiar to you or some of you, and it stands for rest, ice, compression, and elevation. This is a protocol that was developed by Dr. Gabe Merkin in 1978. He had written a book titled The Sports Medicine Book, prescribed this as a protocol to help expedite the healing process with acute injuries, such as an ankle sprain. However, his claims for R.I.C.E, while they were unsubstantiated, really took off and became the popular protocol for managing acute ankle injuries. Now, fast forward to 2015, Dr. Gabe Merkin has since recanted his protocol in light of the abundance of research that has come out to say or suggest otherwise, suggest that the R.I.C.E protocol, in fact, does not expedite the healing process, but just the opposite, may hinder it. And we'll talk about that in just a minute. So backing up to my own personal experience, I sustained an ankle sprain, a pretty severe one on my right ankle when I was first playing soccer. And I remember it, got really swollen immediately. I had heard a crack when I stepped in this hole off of the field and felt my ankle twist. So I knew something had happened. I knew at the very minimum it was a sprain, but I was convinced, it was something more. So of course we had an x-ray, totally fine. It's just a sprain. But at the time, the way it was managed was I was put on crutches. I was advised to not weight bear on it at all. Putting my foot in a bucket of ice till it got numb and tingly was like standard protocol every night. Trying to, manage the swelling, manage the inflammation, try and keep that to a minimum. Because again, the thought was managing inflammation, managing swelling would lead to a faster recovery. However, if we look at the pathology of tissue healing, whenever tissue sustains an injury, it has to go through the inflammatory process, which is usually 0 to 72 hours, give or take. That's different for folks for various reasons. Now, inflammation is good because it basically brings all like the big guns to the scene of the crime. It brings all of the dump trucks that are going to help like douse the fire. It brings all of the fire trucks that are going to douse the fire. It brings the dump trucks that are going to try and take some of the junk away. But we need to get an influx of this stuff to that tissue to initiate the healing process. So what research has looked at and what studies have come to confirm is that, if we start to interfere with that healing process, we could set that person up for an actual longer recovery time in the end. Additionally, we've also discovered that while rest used to be the standard sort of treatment of choice for any kind of injury, we know that movement is more beneficial for folks, not only in the long run, but even in the short term in terms of healing. So we've found that exercise and early weight bearing for managing ankle sprains is really the more ideal approach when it comes to managing ankle sprains today. So for me, it took several weeks to get back to playing soccer and basketball and walking without pain. And even then, I was wearing restrictive ankle braces or athletic tape to, theoretically prevent an ankle sprain again. And I was regularly icing and elevating because, again, I thought that was like a crucial part of my healing at the time. Eventually, of course, I returned to like my normal activities, but like many folks who sustain an ankle sprain, I still have some residual weaknesses on that ankle compared to the one that hasn't had the sprains. But that's just sort of the way the cookie crumbles, as they say. It's sort of like we can't really avoid that. If we sprain our ankle, unfortunately, the degree of tear that our ligament sustains. Let me back up. The integrity of the ligament, once it is torn, will never really go back to the same like tensile strength and integrity that it once was. So it'll always be at risk. Once you sprain once, your ankle, no matter the joint, but your ankle will be at risk of, or at a greater risk of spraining again compared to someone who's not had an ankle sprain. So fast forward, now it's 2015. Dr. Gabe Merkin has now recanted his protocol of R.I.C.E to treat acute injuries, to treat ankle sprains, in light of the evidence that has shown that rest is not ideal, that we want to encourage active movement, that ice actually impedes the inflammatory process, which we actually want our body to move through. Compression, while that can be a really effective tool at limiting the amount of swelling, it can also restrict blood flow, which could impair tissue healing and prolong the length of recovery time. And finally, elevation is a really great tool, just using gravity to help drain excess fluid from the limb. I wouldn't hesitate to have anybody use that as a tool, but I also wouldn't be making a point to have someone laying down with their leg above their heart several hours out of the day as part of their recovery. So instead of R.I.C.E, what would I do today if I sprained my ankle like I did when I was in middle school and high school? I would get weight bearing to tolerance through load management. And what do I mean by that? Using an assisted device if necessary. So sometimes the recovery of an ankle sprain can be so dramatic and change significantly in those first few days. It is not uncommon for someone to sprain their ankle and that first day, that first 24 hours, to feel incredibly swollen, incredibly painful, difficult to walk on, only to wake up the next day or give it 24 hours and it's substantially better. So things can change a lot in the matter of days or hours. So the first thing I tell my clients anytime they sustain any kind of injury, for that matter, is pause, take a beat, take a breath, because even though the pain is intense, perhaps the swelling looks severe, it is not uncommon for ankle sprains to look that way. So it doesn't mean that you fractured something and that, if you put your foot down on the ground, you're going to like break it further. It's not that. So it's important to get weight bearing per tolerance, but I don't want to force anyone to do anything their body's not ready for. So I might encourage them to use some sort of crutch or a cane. Perhaps I might immobilize their foot a little bit if that's feeling super painful. It really depends on the level of pain there, but I would get them out of any kind of boot or brace as quickly as possible and transition them into a shoe or barefoot soon. In addition to that, I would also encourage some early and active range of motion. So something as simple as wiggling your toes or getting the ankle pumping back and forth. Those are all things that are really safe to do, especially if you have the presence of an ankle sprain. Now, let's just say this just happened. You're walking down the street today and you sprain your ankle and it's super swollen. I wouldn't have you like forcing yourself to weight bear in a way that's painful. I would be asking you to just listen to what your body is telling you. So again, that first day, that first 3 days even after an injury might be more restrictive in terms of what you're able to tolerate, but don't hesitate to explore your tolerance through weight bearing, your tolerance through movement each day, a couple of times a day, because we do know that healing from an ankle sprain is more effective and more efficient when we can get early weight bearing and early exercise and action. Does that mean that R.I.C.E is totally out the window? Generally speaking, I would say I would lean on ice as a pain management tool once you've tried some other things, and rest only if, again, pain is a significant concern at the moment. You have to really honor what your body is telling you. But the old school method of rest, ice, compression, elevation is done for. We do not need that any longer. So keep that in mind next time you have an ankle injury. If you have any thoughts or questions, please don't hesitate to drop a comment. Hit subscribe. Please follow me on my YouTube channel to learn more about your foot and ankle and how you can better address various injuries that come your way. Take care.